Good evening. Come.
She's my daughter. She's come along with me.
Good afternoon.
Hi, man. Come here or sit there wherever you want to sit.
Thank you.
You're most welcome, sweetheart. Little bit only when we take out the. Yours was a redo, right?
Yes.
I remember that. Okay, now just clean up a little bit. Okay. Good. He's looking very nice. You give him the mirror. You can see the huge improvement. Just have a look at it.
Yes, sir. Yes, it's so good.
Yeah, the whole face has got tighter,
Yes.
younger. Nose looks more manly,
Yes.
proportional.
Yes. And how about the swelling inside?
It'll all go down slowly. You're not having that much of swelling actually. There's this swelling a little bit here and this area, but this is all because of the surgery. You know, it was very loose. We've tightened it up.
Okay.
That won't become like this ever. It will look like
Sure,
that.
it looks better.
Yeah, looks very nice. Take good care of your nose.
Sure.
See the side view also. You can see how much difference.
Yes.
So when your last surgery was done, this would collapse the tip.
Yes.
So then I've reconstructed the tip, septal reconstruction, augmentation of the radix and everything.
Yes.
Look, that's it. Please one more. So this area, it'll come down. Huh?
Yes. It
So now it's looking
different.
straight. It'll come down, but not such a huge dip,
Okay.
but a gentle dip around that part.
Yes.
Okay.
Yes. Happy to see this again.
You're most welcome.
Thank you so much.
You're most welcome. Take care and stay in touch with us.
Sure.
So what you can do is we'll give you a follow-up number.
Yes.
See what happens. I'm always happy to hear from patients after a month, after a year, after 3 years. I don't know, whenever. If you're happy to come this side, just visit if you can.
Sure.
Otherwise, just drop a message how you're doing or what fine stitches they will remove now and clean up the remaining
Okay.
plaster residue.
Okay.
But with regards to stitches, there are many inside your nose. More because in your case, I've done septal reconstruction and so much. But it can be a little longer. What you should not do, especially in the first 1 month, is do something, cleaning or anything.
Okay.
But when you take bath, you can just let some.
Okay. So can I rinse?
You can do that.
Or
You can
are there
apply
any-
some drops.
Any nasal?
Drops will give you. But after a few days, you can do little cleaning, gentle. But be gentle with your nose.
Okay.
And don't make her sit on your lap.
No, yeah. As I have another younger son.
That is a very common way you get
Yeah,
hit.
keep him away.
They move, it
Yes.
hits and all of
Yes,
that.
yes, yes.
So be careful with that.
Yes.
Then avoid vigorous exercise
Okay.
and gymming or swimming,
Okay.
stuff like that for another 4-5 weeks.
Okay.
Diet, no restriction, you know that. But avoid smoking if you are. Don't smoke. So that's the only requirement, only thing that for good healing. Take good care, that's it.
I can have the regular diet.
Absolutely. Anything you
No
want.
sniffing.
Nothing. You can do that a little bit and all, no problem. If you have a cold, you have to take some medications for cold. Some patients immediately can get something, some blocked nose, and you just take, especially this kind of weather. So in any case like that, you take a regular medication to cover that.
Okay, sir. Thank you so much.
Welcome.
Thank you so much. It's my. I don't have words to express. So this was a 35 years of struggle. So when I fell down in my school, so that's when the septum was deviated and it was just like growing. This was growing and I had this breathing difficulties for a long time, and that was once it was done in 2015. The procedure was not correct. So now I can see the difference, the facial difference and the constrictions. And the only thing is if I can able to breathe completely.
That will
like-
happen slowly. It's still blocked because, like I said, there's a lot of crust inside,
Okay.
and you can apply those drops to get it down
Sure.
even more quicker.
Thank you so much, sir. I wish you all the best, and I
Thank you.
hope we'll definitely remember all this team and our prayers, and we
Thanks, kind of
we
you.
do recommend, and we of course
Pleasure. Thank you.
Thank you so much, sir.
Thank you.
Can we leave?
Yeah, sure.
Thank you so much.
Bye-bye. Bye.
Thank you.
Thank you.
Thank you.
You're welcome.